12 to 15-year-olds could start receiving the Pfizer coronavirus vaccine as early as Thursday. As expected, on Monday, the Food and Drug Administration approved the Pfizer vaccine for that age group. This morning, Dr. Dana Hawkinson from the University of Kansas Health System joins us live to talk about this. Doctor, we know that the CDC still has to rule on this, but that's expected to happen, so those shots could happen as early as Thursday for that age group. I want to ask you about kids younger than 12, because I think that's the next question for a lot of people that maybe have those younger kids. My kids are all younger than 12 years old. What do you think the outlook is for vaccinations for the younger kids?
I think it's the same as for the 12 to 15. We know that these vaccines are safe now. We know that, younger people may tend to have less side effects than the older age group. So I think the same thing is going to happen. We need to get the data. We need to really make sure that it is safe and analyze the data and show that, but I believe they will be shown to be safe as well as effective. So I think that will be, the next thing down the line is getting even those younger age groups, 2 to 12 or even down to 6 months at some point. But certainly getting more and more kids vaccinated is going to be very important. And I think these are going to show to be safe as well as effective.
Well, we had a stat earlier today that if the CDC approves the 12 to 15-year-olds, that's another, I believe, 17 million Americans in that age group that will be able to get the vaccine. So that's a lot of people with vaccinations in their arms. A lot of parents' minds, of course, on the vaccine for their kids. But childhood vaccinations other than COVID-19, I understand, have dropped a little bit since the pandemic began. Can you talk about why this is a problem, especially with the COVID vaccine now being available to a younger age group? Because there's a timeline situation there when you're able to get vaccinations for your kids, right?
Oh, yeah, absolutely. I think individually for your child, we don't really understand the impact of some of these vaccines because luckily we were not around when these diseases were causing serious morbidity, illness in these children. Things like measles, mumps, rubella, things that we've heard MMR vaccines about, but we don't really understand the impact that they have and what those actual diseases can do to children. So we are lucky in that sense, but we have to understand that these were brought about to help prevent children individually get those illnesses and get those complications associated with those illnesses. Now, on the broader population level, the herd immunity level, that is just taking more people out who are susceptible to that disease, removing them from the population because now they are vaccinated, they have immunity. That protects the population as a whole. And even things like pertussis, though that is another, or whooping cough, that is another disease that we can spread and children can get, and people understand what that is. A real bad cough, they can get very ill. But also as adults, our immunity from those vaccines does wane. So it's important for adults, especially parents and grandparents, to get it so they're not spreading it to young newborn babies. So overall, I think it is difficult, and we know that there are a lot of voices out there, a lot of misleading information about vaccines are not good and they cause certain problems or issues. None of that has been shown to be true, but we know the impact and the beneficial impact of these vaccines, not just COVID vaccines, when and if they do get approved for those younger age groups, but really all of these vaccines. They are important because what they do is, again, protect the individual from the disease and from the complications of the disease, but also protect the population as a whole by removing any of those other susceptible people out, because now they're vaccinated and they have that immune response.
Yeah, I remember having the fun conversation with my parents of forcing them to get that pertussis vaccine whenever my oldest son was on the way so they could hold him in the hospital. One last thing I want to ask you about this morning, Doctor. This past season, the CDC reported fewer than 2,000 lab-confirmed cases of the flu in the U.S. You've talked a lot about this year about how low flu numbers were. Lots of medical leaders say this is thanks to the masking, the social distancing. It's a side effect that maybe we weren't necessarily thinking about. But those rules are going to loosen as we get ready for next flu season. Is the flu going to come roaring back? I hate to even ask that question. We're in the middle of a pandemic still. But what's the outlook on the flu after a lower season this year?
I don't know that it'll come roaring back. I think there may still be guidance of recommendations of masking, especially during that typical respiratory viral season, which includes influenza, which is usually October till April or so. Hopefully not. I think it will be a little bit more difficult right now to find out what exact flu strains to use. We have to see how the Southern Hemisphere goes, because what they do is 6 months ahead of time now, coming up, they identify the most popular or prevalent circulating strains of influenza. That's what they make the vaccines to. So they'll make those vaccines. I think it will still be incumbent upon everybody to get the vaccines. But I don't know that I expect necessarily a roaring back. I think we still will be dealing with COVID-19. I think there may still be recommendations, although not mandates and not strict recommendations, but people will understand the ways to protect themselves. And we have seen, because we didn't have vaccine for COVID-19, the main way that we were really stopping flu this year is from those non-pharmaceutical interventions, the masking, the distancing, the good hand hygiene. We may just go back to a normal flu season. Certainly this year was much better, but I think that remains to be seen. And we'll just kind of also keep our eye really on what's going on in the Southern Hemisphere. Although we know, not as many countries are as fortunate as we are as far as vaccination levels go. So we just have to kind of keep our eye on that and watch the influenza activity that's going to be happening in the Southern Hemisphere now in these next few months.
Dr. Hawkinson covering a lot of bases for us this morning. As always, Doctor, thank you for your time. We appreciate you having us, being on with us this morning. You can watch Dr. Hawkinson every Tuesday morning here on 41 Action News. And of course, he's on the daily call with the University of Kansas Health System that we stream on our Facebook page from 41 Action News that starts every weekday at 8 a.m.